having a very ethnically diverse practice like us, we hear a lot of questions from patients who are concerned of having a natural result. When you have a flatter nose, a little bit of width, there's really a strong fear of, hey, what if I end up looking like Michael Jackson?
Yeah, we hear it almost every day, and it's a very common fear. The main issue and concern for a lot of patients is having pinch look for the tip itself, and then the nostril reduction. A lot of our African American and Hispanic patients are afraid of having that very tethered, triangular, stuck down kind of look to the nostril. What's important to understand, when it's done properly by surgeons who really want to know what they're doing, but also have a really good sense of what the aesthetic should be and how far to go with it, all of these issues are completely preventable, should never happen, and never do happen in our practice.
Yeah, it's important to understand, a lot of people think, hey, those people have a lot of money, and despite that they ended up with these results. That doesn't always, translate. It doesn't mean just because they have money they were informed well and really understood the process. Doing a proper alar base reduction, which I give Dr. Litner a lot of credit for his research into the topic and understanding into that, really allows you to have a natural reduction in the nostril that really maintains the natural flare. You can bring some of the rounding in, but there's no need to get that triangulated look. Moreover, there's no reason where all the cartilage needs to be removed or anything like that needs to happen. In fact, in most of our patients, if you've got a really flat, wide nose, you actually have to get some tip projection, which means you got to build up some projection and build some support. So there really is no need for that fear or concern that that's going to happen.
Yeah, that's the really important part. You can get a really dramatic, beautiful change that still looks natural. And the reason for that is using the techniques we use, which actually reinforce, support the cartilage, and at the same time bringing the nostrils in a natural way, as opposed to using some of the older, more traditional techniques which involve taking away a lot of cartilage and taking away support. And that way we can make sure during surgery that we can be very precise about the change that we create.
So I think that's the key takeaway. The key takeaway is really just make sure you see a surgeon who has a lot of experience with this, who understands how to deal with these issues and is able to communicate with you effectively to answer all your questions and tell you how they would approach this.